AC.
Morning, John. How are you?
Wonderful.
Did you hang your painting?
Pauline, did we hang the paintings?
They're in the mudroom.
They're in the mudroom. Oh, dear.
John, did you paint?
Oh, yeah.
This is your painting? Like you did it? You painted?
Oh, you never saw it, Joe?
No.
Absolutely stunning. I think you should use it for a silent auction prize.
I am not Picasso. If I can find where they are, I'll let you see it, Joe. I'll be back in a moment.
John.
Steve, how many are you expecting?
No idea. We're at about our normal amount right now, but normally we get going about 3 minutes past the bottom of the hour. That allows all the stragglers time to get going. So we'll keep to that normal timeline.
Sounds fabulous. Thanks for including us.
Wow.
Our pleasure.
Beautiful,
There you go,
John.
Joe.
That's great.
It ain't no Rembrandt.
That's fabulous. Good for you.
The main thing is it was fun.
We should put it up for auction, Steve.
People will pay thousands of dollars for this. Thousands of dollars.
Yes.
I paid $10.
Okay, there's the first bid at $10.
$10.
Will give me 20. Oh, dear. Yeah, you guys are crazy.
There's mine.
Oh,
Hi,
Pauline
Amy.
has hers up.
Hi.
oh, I see yours, Pauline.
Yeah. That's nice, Pauline.
Oh, we had fun.
Good morning to all the visiting Rotarians.
Oh, there's a good number.
I mean,
There
Yeah.
certainly is.
Morning.
Mark
They all came-
Weaver.
They must have heard we were having pancakes today.
It is
Mark,
Fat
you and I met
Tuesday.
years ago when I was at the CBC. No, he's not listening.
Hi, Joan.
How are you?
Wonderful.
Good painting, by the way. So many skills. This was very nice to invite us on this snowy day and not.
Well,
have
it's
to drive.
it's an important message, especially today.
Yes.
So we thought we may as well maximize Dr. Kyle's time. So
And you know what's even more important on a snowy day?
Yep.
I don't know if I would have driven there this morning.
Yeah,
I
I was even leery about getting to the living room.
I managed that.
This is ideal because I still have my house coat on.
I don't have one.
I was thinking the same thing. This is worthy of a happy buck for COVID. Didn't have to clean the car this morning.
good morning, Gord.
There's Joseph.
Morning, Emmy. It's nice to see you.
Good to see you, my friend.
I guess you're
Hi,
happy
Joseph.
today. You're not out saving people?
Good morning.
Not today. Shoveling snow today.
Oh, it was actually gridlock between Newcastle and Bowmanville today. Go ahead, Steve.
No, that's okay. That's all right.
Oh.
We'll wait one more minute here to collect the remaining stragglers.
I see my name is popular today.
All right, Mr. Snow. Leah Bourgeois, your mom was out at 6:30 this morning. She beat me to the snow blowing.
It's a competition, Steve.
Yep.
I'm hoping she'll make her way over here, but we'll see.
Hello, Wayne.
Hi, everyone.
Hello, Johanna. And here comes Renee.
They won't know I'm on the call.
Okay, well, we're at 7:32. We may as well start to call things to order here. I know our guest, Dr. Kyle, is pretty tight at 8 o'clock, so we want to make sure we get through the programming. First off, welcome to everyone to the February 16th meeting of the Bowmanville Rotary Club. We've got lots and lots of guests today, so I'm not going to be able to get through and name them all, but we've got guests from all over Durham to come and see Dr. Kyle speak. So welcome to our meeting, and you're all welcome to stay for the full duration, or if you want to jump off after Dr. Kyle's done speaking, you're welcome to do that as well. We understand everyone has busy days. So we begin the meeting with our toasts. First to Her Majesty, to the Queen,
Queen.
to Canada,
Canada.
and Rotary International. There we go.
Rotary International.
And on this day, I guess we should be toast everyone with a snow shovel in their hand, but to all the shopkeepers that are opening up for the first time in several weeks. Here's to them. All the best. Okay, with that, over to our invocation. Camille, I believe that you're on deck to do that.
Morning, everyone.
Morning, Camille.
So may those assembled here today enjoy the many offerings of Rotary. May we abide by the rules we've established, those of trust, fellowship, and ethics. And may we place service of himself in our daily endeavors. And may we always test ourselves and our efforts to be sure they are the truth, good for all concerned, and provide peace and understanding.
Thank you, Camille. That was great. Quick reminder to everyone, if you're not speaking, to mute your microphones. Okay. And over to Secretary Pauline. Birthdays and anniversaries.
President Steve, we have a celebration this week. Is Doug Sears on the call? If not, maybe he's celebrating early because Doug has.
Yeah, I'm here.
Oh, you're here. Okay.
Oh, yeah.
Doug, happy birthday on Monday.
Thank you.
And also this week, since we are not meeting next Tuesday, we should remember there's a very special 116th birthday next Tuesday, and that's 116 years of Rotary International. And that's it.
Wow. Thank you.
Excellent. Thank you for that. And moving straight through to our main program, in the interest of time, Joe, would you do us the honor of introducing our guest?
I certainly would. Thanks, Steve. The last time today's speaker was with us was back on July 21st. Durham region was getting set to reopen what was then called Stage 3. You might remember that in the COVID protocols that allowed for the reopening of indoor service and restaurants, also theaters, casinos, fitness centers. Now, here we are again on the very day of another reopening. Actually booked this a few weeks ago, and here we are, coincidentally, in what's called the red zone, the resumption of indoor service in places like restaurants, hair and hair salons. Dr. Robert Kyle is back with us today. He is, of course, Durham's Medical Officer of Health. Welcome, and thank you for coming, Dr. Kyle. Quickly, before you start your presentation, I remember this really stuck out for me and a lot of people when you were with us the last time, and we asked you, how would you describe the COVID situation in Durham? And you used the word smoldering. How would you describe it today as we enter another reopening? You're muted.
Yeah, so I would say that it was a blaze. The embers are cooling somewhat, but variants of concern is kindling that could be used to, in fact, incite another blaze. So it's certainly beyond smoldering. It is cooling somewhat, but the situation is precarious.
Okay, your presentation. Thank you.
Yeah, so good morning, everybody. I'm going to share my screen. I see a couple people are on the phone. I'll try to go through the deck slowly. I believe we have sent the deck to the organizer, so feel free to flip it to those who are on the phone and anyone else. So just bear with me for a second.
The locals better.
We got you.
So I've been asked to give an update with respect to COVID-19 and then answer your questions. I will be going through the deck fairly quickly, but I am mindful of those that are on the phone, so I'll try to describe what's before you. So what you have on this screen is the current status of COVID-19 as of yesterday. The key point is we are down to 289 cases. It seems like a lot, but there was one time where we were hovering around 1,000 total active cases. So it's down considerably. The numbers with respect to hospitalization, 21 and 13 in the ICU, is going in the right direction. And if you look at the graph on the right-hand side, it compares and contrasts the first wave, which, as you can see, is a bit narrower and a bit less high, with the second wave that we're currently in in terms of, and by the way, all of the stats here you can get at durham.ca/COVID cases. They're from our data tracker. So currently we have 14 institutional, i.e. long-term care home and retirement home outbreaks, down considerably from a few weeks ago. And we currently have 3 child care center outbreaks, a bit early with respect to the schools, since they only have been back for a week. In terms of other places, you'll note that 1 group home outbreak, 1 hospital, and I think it's 5 workplaces. I can't see the last bar graph. And this shows you the exposure source. I don't want to go into it in too detail. And for those of you on the phone, it shows it's a graph that shows the first wave versus the second wave in terms of the source of exposure. So outbreak, household contact, workplace contact, and so forth. You will note that in the first wave, most of the cases were either travel or outbreak related. So that's why there's a preponderance of bluish colors. In the second wave, you'll see a preponderance of community, household, and other close contact. But as we got into outbreaks, you can see more blue towards the middle of the second wave. I don't want to go into our, I'm going to say, service stats in any great detail. This infographic is on our website at durham.ca/coronavirus. The stats on the left speak to numbers of investigations, test kits prepared, phone interactions, and the metrics on the right speaks to outbreaks in a variety of different settings. Just flipping the page to the end of the infographic, the ones on the left speak to cases and contacts followed, nursing assessments, paramedics do our nasal swabbing. On the right, clicks to the data tracker, just under 1.5 million, test results received, calls to cases, and then a smattering of other stats on the bottom. It speaks for itself, and I think the key message here is we've been extremely busy, and it's been a team Durham Health effort to date. So as you know, Durham is entering the red zone of the provincial response framework today. Just because businesses and workplaces are permitted now to open if they've been closed doesn't mean they have to, but they are permitted to do so. And because we're in the red or control zone, there are broad scale measures and restrictions across multiple sectors to continue to control the transmission. And the restrictions are the most severe available before wide-scale businesses and organizational closures, which would be the case in gray lockdown. A question that is asked of me is, how long will we be in control red, even though our metrics that I've just described are in pretty good shape? I don't think the province is anxious to let its foot off the brake anytime soon. I expect we'll be in control red for a couple of weeks. As you're probably aware, and this is on our website and on the COVID-19 response framework, if you Google that and go to the ministry's website, there are a number of measures the province looks at on a weekly basis. So that includes the average number of cases per 100,000 per week. The threshold for red is 40. We're sitting around 39 at this point in time. It looks at positivity, the number of positive tests. The percentage threshold is 2.4. We're sitting around 4, a little bit higher than 4. And then a measure of how readily one case can infect others. It's called the RT value. Ideally, you want it less than 1, and I think we're sitting around 0.8. So the metrics are in good shape. But as I said, looming out there are so-called variants of concern. You've heard of the UK variant. You've heard of the South African variant. You've heard of the Brazil variant. Why this is of concern is its transmissibility. Their transmissibility is much higher than the current strain that is endemic in the Durham region. And so it can lead to much more explosive outbreaks, such as the one that is being investigated in Mississauga, I believe it is today. So this is a response framework. As you see, it's color-coded. We're in red. There are certain thresholds you have to meet before you go from one color to another. Just a reminder that the response framework centers on and tries to mitigate certain key risk factors for potential transmission. And they're listed there: close contact, close spaces, crowded places, prolonged exposure, and forceful exhalation. And just as a reminder, it's not just the numbers that are of concern here, it's the impact on responders, public health, hospitals, and so forth. And the reason we went into shutdown over the Christmas time were not only that the numbers were out of control, but of course that led to far, far greater hospitalizations, including ICU admissions and vented ICU. So you're trying to preserve capacity in our responding health system partners. So if you want more information about the red control zone, think about where we were in Durham region just prior to the shutdown, which occurred, I believe it was on Boxing Day, and that'll give you a pretty good sense of where we're at. Having said that, the response framework has made some additional requirements, which you may or may not perceive at the ground level. So there are capacity limits with respect to big box stores. There's the posting of the capacity limits for big box stores. And there are workplace safety plans that are required across quite a number of different sectors. So drilling down a little bit more, for those on the phone, this is just a screenshot of our community reopening toolkit. And if you were to go to that page, we have some posters that tell you what the general and specific requirements are. And then we have an associate FAQ sheet that responds to questions you may have. And you can get this again at durham.ca/reopening toolkit. So you may be interested in COVID-19 vaccines. Let me just say that there are only 2 vaccines, as you know, licensed for use in Canada: the Pfizer vaccine, which we have in Durham region, and the Moderna vaccine. We've had some shortages of both vaccines, and so the target of vaccination to date has been high priority individuals and workers. So, excuse me, all eligible residents of long-term care homes and high-risk retirement homes should have received 2 doses of Pfizer vaccine. And so with the stocks remaining, which will take us probably until the end of February, those shots will be given to healthcare workers who've already received their first dose. For the month of March, again, we will have limited supplies. The province has issued direction with respect to other essential healthcare workers who require 2 doses. So that will happen in March. Those include essential workers in long-term care homes and high-risk retirement homes and essential caregivers. The platform that we will use to keep the public updated with respect to all things COVID vaccine is durham.ca/COVID vaccines. You may be interested in knowing, well, when will this get into the arms of the general public? Well, we need vaccine. Behind the scenes, there are many tables that are working on, in particular, community clinics that are slated to be held in most, if not all, municipalities. A lot of details are going into setting up the clinics. Those who are eligible to get vaccinated will be directed by the province, and fixed community clinics will be supplemented by mobile clinics to get at high-risk individuals and groups who can't make their way to community clinics. So that's kind of, in a nutshell, our planning to date, but we don't have enough vaccine, and we won't have enough vaccine beyond targeted groups until probably April at the earliest. This is the last slide, and it shows you a number of useful links to our resources. And of course, I would refer you to any credible source, Ontario Government, Public Health Agency of Canada, should you have questions that can't be answered at our website, but nonetheless are credible sources of information. So President Steve, I'm going to stop there, and I'll take your questions. And as I said, if you are on the phone, I will have you contact President Steve and or Joe or whomever the organizer is, and let them send out the deck if you find it useful. And of course, go to our website. That's it for me, and I will just escape here.
All right, Dr. Kyle, I will gladly send out the deck to everyone. We've got a few minutes for questions. Who's first? Show of hands here. Lyle, I see your hand first. Lyle Gooden.
Dr. Kyle, we've seen the UK virus, the B113, rip through New.
Oh, we lost Lyle.
Yeah, so I think he was saying it is responsible for what's happening in Newfoundland and Labrador. And I think that speaks to the transmissibility. I don't think Ontario, though, I'm sorry, I don't think Newfoundland and Labrador is in the same place that Ontario was. Far fewer cases, so no routine mask use, and none of the restrictions that were in place in Ontario. So it was kind of ripe for the picking. But it does indicate quite graphically, I suppose, how quickly these variants of concern can spread. And of course, our big concern is we wrestle the current second wave and the current circulating virus strain to the ground, only for that to be replaced by a third wave. And that's why we need to continue to be vigilant, even if you're vaccinated. And there are multiple strategies in place to make that happen.
Thank you, Dr. Kyle. The next hand I saw up was Emmy.
Thank you for the opportunity. Dr. Kyle, first of all, thank you. And I just want to take this moment to also thank you again for your help with my family back in 2015 when my mother passed away and we traveled. Your help was immensely appreciated. My question is, there's been some conversations about possibly vaccinating Olympic athletes who are destined for Tokyo for the Summer Olympics. Is this something that has been discussed in Durham, or is there any consideration for such approach?
I have absolutely no line of sight. And if that's happening, that would be at a national level, I would think. Certainly has not involved us. I suspect, of course, that the health and well-being of Olympic athletes is top of mind. And I'm sure there are many protocols in place, testing and whatnot. And I wouldn't be surprised if vaccination is part of that, but I can't comment. I don't have a line of sight.
All right.
Dave, I have a question.
Okay, Chris.
With all the travel restrictions into the country in place, how do we get all these variants coming into the country now?
Yeah, well, that's a good question. I'm only familiar with the Durham region, and I know of maybe 4 or 5 cases that were travel related. So somebody traveled to the UK, brought it back to Durham with them, and passed it on to the family. I think what is of greater concern is it's getting established in Ontario and indeed Canada, which is what you would expect with heightened transmission, particularly if some unsuspecting exposed individual has no symptoms or is pre-symptomatic, which has been a common scenario in terms of community transmission. But obviously it's been travel related, how that happens, and how do they break protocol and so forth, I don't know. All I know is that some of the cases in Durham were imported.
Thank you, Dr. Kyle. The next hand I saw up was Ellie, Ellie Brooks.
Hi, Dr. Carl. Twofold. The first question that I have is, have we had any doses coming to Clarington? Because I've been hearing from people that our homes have not had any vaccinations. And the second question that I have, with the number of doses that are allotted to the province of Ontario, is any of these doses slated to come to Clarington? I mean, we're hearing that they're going to, Toronto and the Greater Toronto area, Ottawa, like the big areas, but I'm not hearing anything's coming to Clarington.
So the only so thanks for the question. The only vaccine that has come to Durham is Pfizer vaccine. It needs to be stored in ultra low temperature refrigerators, and that is being done at Lake Ridge Health. To its credit, after starting vaccinating healthcare workers and getting permission, if you will, to transport the vaccine from hospitals to the community, mobile vaccination teams were mobilized to vaccinate all residents of long-term care homes and high-risk retirement homes, and that would include those that are in Clarington. And prior to that happening, long-term care home and high-risk retirement home workers, and I'm not sure about essential caregivers early on, would have been eligible to receive vaccine at the hospital site. So we still have a shortage of vaccine. It still is Pfizer. Shipments come to Lake Ridge Health, and from there it is transported to these high-risk sites. And currently, with the second dose for healthcare workers that have already been vaccinated, most of that will be happening at Lake Ridge Health, Oshawa. And I think we're going to have limited supply. It will be Pfizer vaccine. It will be shipped to Lake Ridge Health, and that will be the current state until probably the middle to the end of March. So we're not looking at ample supplies of vaccine in Durham until probably April. The Moderna vaccine, which is more stable than the Pfizer vaccine, is being used preferentially for northern and remote communities, including First Nations in Northern Ontario.
All right.
Answered your question.
If we have time for, sorry, Ellie.
One clarification, please, Steve. So when you're saying in Durham, most of these are going to Western Durham, Pickering, Ajax, Whitby, but Bowmanville itself, that's what I'm interested in. Are we getting doses coming here on, like, is it scheduled to come here?
It is being transported by mobile teams to wherever there are long-term care homes and high-risk retirement homes. I can't speak to Bowmanville specifically, but if there is a long-term care home or a retirement home in our high-risk retirement home in Bowmanville, it would have not only arrived, but those residents would have been vaccinated. Clinics are not being set up in Bowmanville for healthcare workers, including those working in long-term care homes. They have to go to Lake Ridge Health, Oshawa, given the fragility and the storage and handling requirements of the Pfizer vaccine.
All right, Dr. Kyle, if you've got time for a couple more questions, we got a few more hands. I see Joanne Binns, Joe Solway, and Sue McKinnon. We'll see if we can squeeze those in before we go. So Joanne.
Quick question, Dr. Kyle, when we move beyond phase 1 into phase 2, I'm hearing in the media that it will be by year of birth or by age. Will that be by year of birth or actual birth date?
Let me answer it this way. You need to set up a prioritization system that is practical and feasible. And so the highest risk for disease and death, COVID-19, are the elderly. So if what you're asking is, if a 79-year-old showed up at a clinic that was targeted for 80-year-olds and over, would they be vaccinated? Of course they would be vaccinated. I think we want to set up a booking system that is not overly onerous and meant to penalize people that show up at the door. Having said that, the work around booking requirements, date of birth, all that type of stuff is being done by the ministry. I'm going to say in the back office. So how robust that system is, I'm not really sure. But in terms of the general public, I think it's fair to say that using an age-based approach will probably be the way to go in terms of reaching the highest members of the public at risk for disease and death from COVID-19. So 80-year-olds and probably 70-year-olds and so forth. We're still waiting to get guidance from the ministry in that regard.
Thank you.
Okay, thank you. Joe.
Yeah, first of all, it's just a shout out, a reminder of the incredible work that all our healthcare workers have been doing. Everybody in your staff, Dr. Kyle, and everybody across Durham and the province. Just a distinction, sorry. My father-in-law, 94 years old, lives in Bowmanville Creek Retirement Home here in Bowmanville. He has not had the vaccine and does not know when he'll be getting it. I have an aunt who lives in a retirement home. She's 84 and she's in the region of York, and she has already had her second dose of the Pfizer vaccine. Why would that be? And is that because one is a high-risk retirement home and the other is not? And how do you define that? That's what I'm a little unsure of, that why would one retirement home have already been vaccinated and another here not?
So let me answer it this way. First of all, the risk categorization of retirement homes is set by the Ministry for Seniors and Accessibility, and it's based on past occurrence of outbreaks, design of the facility, a number of factors, and we're given the list, and that's who we target. In the case of York Region, it also has Moderna vaccine. In fact, Durham was scheduled to get Moderna vaccine. It was redirected to Toronto, Peel, and York. So it's a far different situation. They have far more vaccine. And, you know, I wasn't too happy about the redirection of Moderna vaccine, particularly given Orchard Villa, Sunnycrest, Thorntonview. I made my views known, but the decision makers made their decision. But I do think York Region and Durham Region is apples and oranges. And I'm sure you're frustrated. And if you are frustrated, don't take it out on us. Take it out on the decision makers who are allocating the vaccine.
Thank you, Dr. Kyle. Do you have time for one more?
One more question.
Okay. Susan.
Thank you, Dr. Kyle. Can you please let me know how we will be notified when it's our turn to be vaccinated?
So we plan to use multiple channels of communication. I mentioned our website, Durham.ca/COVID vaccines. We haven't worked out those details because we have no vaccine, right? So right now our focus is on getting clinics up and running, and there are a lot of logistical issues. It's not just getting vaccinators, but it's setting up places, getting security, getting booking systems, getting the digital platform, security, line management, all that type of stuff. So all of that work is happening right now, but I suspect it would be a combination of both our website, social media channels. I don't want to rule out media or news releases, that sort of thing, but we're just not there yet. And to its credit, the local media has been all over the data tracker, my messages, and so forth. So the message will get out there. And if you, as a group, have any suggestions with respect to channels of communications, let us know.
I guess I was interested too in crowd control. Can Rotarians help with any crowd control situations? I guess we're a little ways away from that yet.
We're quite a ways away from that. There's one person on the phone though that, or on the video, that has some experience. I'm thinking of Emmy as well. So maybe you have an in-house expert. No, I would imagine we would rely on security companies to do that sort of thing, particularly early on. We're expecting there'll be a huge demand. And people get frustrated having to line up. And we experienced that during pandemic influenza. So you need to be trained, and you probably need to look the part with respect to line control, but we're sorting out those details.
Thank you, Doctor.
No problem.
Well, Dr. Kyle, I know that there's an awful lot more questions out there, but we did promise you 8 o'clock, and it's 7 minutes past the top of the hour now. We can't thank you enough for your time this morning. This was really informative, really important at this time. Thank you for all the work you do. Thank you for taking time to speak with us. And you have a lovely day. You're welcome to stay, but clearly you've got lots going on. Thank you.
Yeah, and President Steve, if there are some burning questions out there, if you want to collate them and send them my way, we'd be happy to prepare a response. We may not be able to turn that around on a dime, but happy to do so. But before you do that, go to our websites. We have multiple pages. We have a navigation menu at durham.ca/coronavirus. So all of your questions probably have an answer there. But if not, send something our way. And thank you for inviting me. Thank you for your interest. Have a great day. Have a great week. And until the next time.
Thank you, Dr. Kyle. You have a fantastic day.
Yeah, thank you.
Okay, with that, move on to the rest of our agenda. Before we get to Know Your Rotarian, do we have any happy bucks? See a hand up for happy bucks. I see Fred and then Chris and Pauline. Fred, Chris, Pauline are your first three. You're muted, Fred. Okay, then we'll move on to Chris.
Okay, I have 20 happy bucks. On Sunday, I was one of the people that were delivering the Valentine dinners to people that ordered them, and one of the couples gave me $20 to give to Rotary. So I shall be putting it in an envelope and leaving it in your mailbox, Steve, in the next couple of days.
Thank you, Chris.
And we had the dinner too, and it was very nice.
Excellent.
Are you not doubling that, Chris?
Well, maybe I will.
You're a good friend, Mike. Pauline, I think.
I'm happy to announce that Phil Benner also has a birthday this week. And I'm sad to announce that our club runner records are not up to date.
Okay. Well, happy birthday, Phil. Look at that, a special call out for you. Any other happy bucks? Ellie, and then Dennis.
Just very extremely happy that last Tuesday night I bought a condo. So now Jason has to sell my house. So I'm
excellent. Congratulations, Ellie.
Yeah, it was nerve-wracking.
Where, Ellie?
It's where your friend lives, Wendy lives.
Oh, yeah. Oh, okay. Yeah.
Yeah.
She said you were she had talked to you about that.
Yep. And
good for you. Congratulations.
A unit came up last Saturday and I nailed it Sunday. And I was told Tuesday night it was mine.
Excellent.
Great.
I'm happy.
You'll be needing new blinds.
Yeah. Dennis, we can't hear you.
Yeah, no, I'm just, despite the confusion with COVID-19, I mean, I have a couple of happy bucks with the work that's going on, and pleased that my mother-in-law, who's 96 and at Seasons here in Bowmanville, has received the COVID-19 shot. So it's getting done, slow but sure.
Great. Great.
Steve, can you hear me? Steve?
I can hear you, Renee. Gotcha. Go ahead.
Oh. Yeah, I have a happy buck too, $50 for, first of all, my birthday I had yesterday and the many calls I had. But most important thing is I was so surprised Sunday morning when I woke up and some good spirit came to my house and cleaned my driveway. I don't know like where that came from or who did that. I asked my neighbors, nobody knows. But anyway, it's nice to see that there are caring people in the world who take care of us seniors.
He may or may not have been driving a blue pickup truck, Renee. You're welcome. So, yeah. No.
Well, thank you. That was very much
You're welcome.
appreciated.
Okay. Johanna, quickly, one last one, and then we've got to get on to the rest of our thing.
Yes, I'd like to donate $5 actually. My sister and brother-in-law tested positive for COVID about 3 weeks ago, but they've made a healthy recovery. So very thankful for that this morning.
Excellent. So, I'll exert some executive privilege and do one more. The Valentine's Day dinner organized by the club, Chris, Rachel, the rest of the team, went off without a hitch. Not only did everyone show up on time to get their food, the delivery drivers got things out early, but the feedback online and by email has been nothing but fantastic. It was a raging success. So thank you to everyone involved and everyone who bought. Well done. Well done. And Lyle, quickly, I think you missed the answer to your question. What he said was those variants are racing quickly through Newfoundland because they weren't exercising the same sort of precautions because they haven't had any up till now, and that's probably why it's raced through so quickly there.
Oh, good. I was actually using Amy's internet, so it crapped out right at the end.
All right. Moving on, we've got Lloyd Rang and Phil Benner who are going to share with us Know Your Rotarian.
Well, thank you, President Steve. That's a great intro, and happy birthday once again to Phil. Phil and I sat down for a 10-minute conversation last night that turned into about an hour and a half. And had a really good chat. A couple things that we found out in the course of the conversation was Phil is part of a network called SNABS, the secret network of aging basketball stars, which includes Gord Wallace and Rudy Cravenger. Phil played a lot of basketball in high school and we talked at length about that. Turns out we have that in common. Because I played basketball in high school and college as well, and not nearly to the level that Phil did, but that was kind of the theme of the conversation. As we talked, we realized we had a ton of stuff in common, basketball being one of them. The other one being not just the fact that we go canoe tripping and like canoe tripping, we've actually done some of the same routes through Algonquin, including a big monster route from west to east across the whole park. And Phil's dad was really influential in helping inspire him to love the outdoors and canoe camping. And Phil told me it was a huge bonding experience that he enjoyed with his dad and his friend that one particular summer in the 80s when they did the whole park from west to east. And the other thing that we learned is that bacon sometimes grows on trees. Phil told me a story about the fact that on one such trip, they actually found a treasure trove of fresh food that was stuck up in a tree. And any of you who have been on a long canoe trip know that when you find fresh bacon after eating dried food for weeks or days on end, that's a really, really great thing. And above all, I learned from Phil that, he's just a really dedicated dad. Loves his kids to death, and is, has been, despite his absences from Bowmanville, his absences over the years from Bowmanville to live in the Caribbean, has been really involved in the heart of this community for a really long time, and it was a real pleasure getting to know him better.
Fantastic, Lloyd. Over to Phil, I guess.
Right. Excuse me. I guess it's over to me.
So yeah, thank you last night, Lloyd, for the conversation. That was really good, and learned some unexpected things and so forth that we had in common. So that was great. For those of you who don't know Lloyd very well, Lloyd was born or sorry, lived his younger years here in Oshawa, and moved from there. Excuse me as I riffle through my notes. So I seem to have taken quite a bit of them. So he's in Oshawa, and his father there had owned a clock shop, believe it or not. So imported clocks from the Netherlands and sold them to the general public, to which they at one point had lost a container in the North Sea and the business struggled a little bit. So they moved to Kingston, and he let me know kind of every kid's horror story. His father had a room in the house that was full of clocks, clocks on every wall and such that used to chime off every hour. And when all the family members and so forth would come over to stay at his house, the kids would be taken out of their bedrooms and relegated to the clock room to sleep, where the clocks would go off every hour. So kind of the thing that nightmares are made of, at least for me. So that was kind of an interesting thing. From there, his family moved to Dunnville, where he spent his formative years, and then left to attend Queen's University, where he earned his Bachelor of Education. He worked for a teacher for a few years, and subsequent to that, left for his career in communications. We definitely talked a significant amount about camping and basketball. Those are a few things that we did have in common, discussing some of the similar moves. I was a power forward and he was a center. So we discussed the same type of things, like, what our go-to shots were and all of that. And it was quite an interesting conversation, without doubt. But most of all, just reminiscing about backwoods camping. I mean, a lot of people think, oh, well, I'm a camper. So, they get their car and they go to a park and set up their tent and camp, and that's great. But it takes a very different kind of person to camp in the backwoods of Algonquin Park. When you leave everything behind with a backpack and a canoe and a paddle for 3 weeks at a time, it really kind of defines who you are and how you can, persevere around danger and problems, and just learn those valuable life lessons, for good or for bad, which from one specific story with Lloyd, he seems to have learned a lesson without actually getting killed. So that's a really good thing. He was in the park and wanted to shoot some rapids called the Devil's Chute in Algonquin Park, which is a fairly dangerous set of rapids. And him and the person he was canoeing with said, well, let's take our backpacks and we'll dump them at the other end, and then we'll think about doing it. And when they got there, they saw in the middle of the chute that there was a canoe just like his, wrapped around a bunch of rocks and so forth, and spoke to somebody about it and said, yeah, there was, some guys decided they'd try to shoot these rapids and had some pretty big problems. So they rethunk their decision to do those rapids and remain alive. So a very good lesson to learn, as getting injured in the park is a very dangerous thing. As a matter of fact, from the story that Lloyd was telling, the food that we had found in the park was tied up in a tree and had a note in it saying that the one of the campers had broken their leg and needed to emergency escape the park. So it is a very common thing that happens in Algonquin. So it's definitely nice to hear those stories, and hopefully you've learned something a little more about Lloyd that you didn't know.
Well, thanks, Phil and Lloyd. This Know Your Rotarian segment's working out really well. I really like what we're learning about everyone as we go through. Thanks for taking time to let us know a little bit more about each other. Next, Fred Mandrick, if you're there.
Yes, sir.
A community report. You're muted. You just muted yourself.
How are we now?
You're good now.
Perfect. Yeah, I got very interested about your announcement a couple of weeks ago, or maybe even before that, about this whole project, Great Lakes Water Cleanup. So I always read the district newsletter, and I just pulled all my information from that. And first of all, set April 17th to 24th. Set that week aside because it's a Rotary Great Lakes watershed cleanup. And this has never been done before. And as the note from District Governor Mark Chipman says, the whole Rotary family in District 70 and 70 and beyond is invited to participate. It's going to be, the point is to mark Earth Day for 2021 with the neighboring districts. We'll be organizing a first ever Rotary Great Lakes watershed cleanup on April 24th. Now, just the idea of doing this it's never been done before. We're getting all these districts to do, it's something local that that Rotary does all over the world. So it's kind of a significant thing. To date, we've got commitments from 15 districts around the Great Lakes, including Niagara, St. Lawrence, and Ottawa River areas, and the Erie Canal in New York State. They're naming the event the Great Lakes Watershed, of course, and it was all brought together with Valerie Wafer, our director, zone director, and the Rotary RI president, Holger Knack, and both supportive of the project, and they're giving us that whole thing right behind it. Eh? So that's pretty. I think that's pretty significant that we're working at something that's almost Western Hemisphere focused. Eh? Because as everybody knows, the Great Lakes are the largest body, a freshwater body on Earth. That's pretty big. Yeah. And if you delve into climate change as well as food production on the globe, we are in some pretty tricky situations. And within the next 10, 15, or 20 years, there's going to be a lot of stuff if we don't continue to address it. It's not that we haven't started addressing it, but this is one thing. And I highlighted a few things when I scanned the whole article. The Great Lakes Watershed Cleanup Initiative is an effort to focus attention on the Great Lakes, specifically all the great work is being done on our lakes, streams, and waterways. One of the things to watch is the trash poses a threat to terrestrial and aquatic life. I think everybody kind of realizes that. But here are some of the numbers that the RIT, Rochester Institute of Technology, have put forth. More than 22 million pounds of trash and plastic pollution ends up in the Great Lakes every year. Globally, each Earth Day, over 1 billion people worldwide work together in their communities to clean up stuff. The Great Lakes contains almost 20% of the world's water, and the Great Lakes system is arguably the largest source of fresh water on the planet. So that sort of verifies me in case you thought it was just BS. Each spring, numerous cleanups events occur in the States and Canada throughout the watershed to remove accumulated debris, shopping carts, tires, furniture, trash, numerous foam cups, plastic containers, aluminum cans, along with our waterways and greenways. Okay, so the cleanup events remove thousands of pounds of garbage from the environment each year. Unfortunately, after each cleanup, the debris continues to accumulate. So, like many things, if by your efforts, sometimes you just enable the guys and gals that are doing it. So in order to track our success, one of the things they're doing too is the second goal of the effort is to tabulate the amount of debris collected and at each of the individual events. There's also specific objectives. One is improve the aesthetics of the Great Lakes, which sort of goes without saying, reduce the amount of plastic and litter, remove the waste that could potentially be ingested by pets and other wildlife and human life too. Provide, and four, prevent the opportunity of public participation in collaborative activities. What an opportunity to collaborate with all non-Rotarians and other organizations within our own community. Provide an opportunity for public participation. Educating the public is another one. And the sixth one, collect and report back to the organizers. So in closing, we've got a really great opportunity here to engage many districts, clubs, and Rotarians, find out what's happening in their communities regarding their cleanups. And if there's an opportunity here, if there wasn't one in some of the areas, we have them here, but some areas probably don't have anything going on. And this is a key thing too. If any of the groups or areas need support, it's available through either in any of the districts. Correspond with the district contact to provide your cleanup and event date, locations to be announced, and all of that stuff. So I think it's a great opportunity for us to get together and do some really good, expose ourselves and get our name out there in the community,
careful,
tell them
Fred.
what we're doing. Yeah. Okay.
Well, thank you, Fred. So both Fred and Lloyd, I think, have stepped up to organize Bowmanville's piece of the Great Lakes watershed cleanup. So we'll be hearing more. They'll assemble a team, but basically on the 24th, we're going to be out picking up trash and weighing it, I guess. So
yeah,
thanks very much, Fred, for your time, and we're looking forward to that.
You bet.
Okay, a couple quick announcements. Johanna put something in the text that I hadn't heard about yet. She's going to be organizing a snowshoe through Ganaraska this coming Saturday. So watch for an email about that. If you've got snowshoes at the ready, come on out for a walk. Also, next week's meeting is not Tuesday morning, it's Thursday evening, and we're doing a trivia night. So putting together questions. We're going to do multiple choice like we did the last time, just to make sure that everyone's got a fighting chance of getting some right answers. And then an interesting bit, Rob Pope from Port Hope, I think, sent out a request this weekend looking for a trivia presentation. So he's using our questions, answers in my deck from the last one for their trivia night coming up. So that's next Thursday, 1900 hours. And with that, over to Dennis for our quote of the week.
Thank you.
There we go.
The quote of the week, the greater danger for most of us lies not in setting our aim too high and falling short, but in setting our aim too low and achieving our mark. Michelangelo.
Excellent, Dennis. Thank you very much. Now, if there's nothing else for the good of Rotary, pausing for effect, remember in the things that we say and that we do, our four-way test. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? And with that, have a fantastic week, everyone. Watch your backs as you shovel today. Take care. Cheers.
Have a good week.
Thanks
Bye-bye.
for the invite.
And thanks for all of our guests for coming.
Hi all. Thanks everyone for
See ya.
coming. Bye-bye.
Bye.
Very much for the invitation.
Hi, everybody.